Okay, so I'm Diane Finnestead Ellis, and this session today is about United Healthcare. We have Alex Ochoa joining us from United Healthcare, and Phyllis and Sandy. Before we go into just kind of like a normal, it's almost like a podcast type of a thing where I'll ask some questions to Alex in general about United Healthcare, and he'll be able to answer for us. Oh, Courtney, there's someone else too. Donna just came through. She's needs to be admitted. You might have to sit here for a
I
minute.
will.
Okay. All right. So Phyllis, did you have a certain question on your mind when you signed up for this particular call that you wanted to know directly about United Healthcare or your plan?
Yeah, I wanted to know specifically what changes because, I changed from PPO to HMO, I guess. So I need to know
Okay.
more about that.
And you
And
went to the select HMO, the ST4, right?
well,
The one that has the $4,000 a dental? Is that what your
yes,
card says?
yes,
Okay.
yeah.
So I'll have Alex go over that so that you'll know. What else was on your mind?
Um, I think my copays changed, and I just, wanted to know just basic stuff if anything's changing, if it's
Okay.
getting better or not, So
I'll let Alex. So that one's for Alex. He's gonna
okay.
answer that. Okay. And Sandy and Donna Sturgis she just joined us too. Donna, did you have any questions, or Sandy, did you have any questions for Alex directly that he can address right up front? You guys can type it into the chat and we can see it. What is it saying? Diane, blah, blah, blah. No specific questions, just want to have an overview of the PPO benefits for your brother. Okay, absolutely. We can do that. Okay, that sounds good. So, Alex, I am going to welcome you and ask you to kind of go over the HMO benefits on the HMO ST4 versus the benefits on the PPO. And Sandy, which PPO was it exactly that he has? Was it the PPO one or the PPO two on his card? I can't remember. Over the counter. Oh, you like to go over the counter benefits. Yeah, those are available on the HMO only this year. And you can't remember which one. So we'll go over both of the PPOs then, because I don't have it right here in front of me. So, all right. So Alex, so I'm going to let you take it away with benefits.
Diane, on your end, I was trying to share my screen and it doesn't show that you guys enabled that feature. Are you guys able to enable that
Yeah,
so I can share my screen?
we are trying to do
Do
that.
you know how to do that?
Where would we go, Alex? School us.
Oh, I'm not very versed in Zoom. We use Teams over here. There has to be a settings, I would assume. Let me look. More.
Oh, hang on. I think I figured it out.
Okay, good. Let me know when you think it's ready.
I think it's ready.
All right, let me try. Bingo. All right, thank you.
Mm-hmm. Welcome.
Let me know when you guys can see that.
Yay! Ta-da, ta-da, ta-da! We can see
All
it.
right.
Yay, very good.
So thank you. Diane, thanks for having me again. My name is Alex Ochoa. I am a market growth manager here in the St. Louis office. So we want to thank you for your partnership and thank you for your business and your trust in United Healthcare. So Phyllis, just to specifically answer your question, there's a lot of changes for you since you went from a PPO plan to an HMO. The biggest difference between a PPO plan and an HMO plan is the fact that you no longer have access to out-of-network benefits. You are now, you have to use network providers. There's no longer any coverage when you go outside of the network unless there is a case of an emergency. In the case of a true emergency, you don't have to be searching to see what hospital is in network or anything like that. You go wherever you need to go, and then you're covered. So the PPO, people who usually choose PPO, it's because they want the freedom of going to any provider that they want, whether they're contracted with United Healthcare or not. And that's the major difference with PPO and HMO. Another difference might be on some of our PPO plans, you pay a monthly premium, whereas with an HMO, you'll never pay a premium. So that's the major difference between those two plans.
So if I
So
have something really serious and my doctor wants to send me somewhere else to another doctor that's not in the network, I can't go, huh?
So part of the contractual requirements of your doctor, if he's in our network, if he's referring you anywhere, it's his contractual obligation to send you to someone that's in the network. They'll never send you to someone who's not part of the network.
Ooh.
Yep. So you don't have to worry about that.
The beautiful thing is that UnitedHealthcare has the largest network nationwide for the over 65.
I
So
was going to
that
let Diane say that. That's 100% correct. So we boast and we're very proud of our national network. So I think that's one of the things, this year there was a lot of communication about PPO and HMO and what's the difference and why PPO is way better. Truthfully, with the size of our network, HMO plan, there really isn't a reason to be on a PPO and to be paying a premium unless you're just if you're in a rural area, that changes things a little bit, but especially here, like in the St. Louis area, all the hospitals are part of our network. All the major physician groups are part of our network. A lot of people say, well, I spend the winters in Florida and I'm in Florida a lot. Guess what? We're there too. Oh, well, I go to Arizona. Guess what? We're there too. We're everywhere in the U.S. So we have a great big national network. So you'll never need to worry about that. And again,
Okay.
the providers that are contracted, those are parts of their contract. I mean, they have to send you to places that are part of the network. That's part of the reason they signed up with us.
So just
So-
not the local network, the nationwide network.
It's
then.
a nationwide network. That's correct.
So
Okay.
the other thing to remember is that I tell everyone is that if you're on an HMO, it's like they are your doctor is your quarterback. They're
Yes.
calling all the plays. And
Yep.
Okay.
so they're all on the same team. That's what you're going to do. But if you were in a PPO, you could change jerseys and go play for the other team in the same game.
Oh, okay. Okay.
That's the best way I can describe it to you. But also it happens to be when you go to the hospital, because that doctor has been your quarterback, it is very easy to find your records. So when there's a shift change at the hospital and you have a shift change with the doctors, it's a lot less time for them to access your records. So it's not as often when they switch a shift where the nurses come in 6 hours later and they erase the other nurse's name and they put the new nurse's name in the hospital and then they ask you all the health questions over again. Typically with the HMO, they don't have to do that. It's all right there. And sometimes with the PPO, they do have to do that because you've been seen in different networks and in different hospitals. So doctors aren't all in the same network. So anyway, so you're allowing your doctor to be your quarterback when you have an HMO. To make sense.
Okay.
And that's the perfect segue into my next point about the differences between the PPO plan and the HMO plan. So in 2026, the HMO plans went back to requiring referrals to see a specialist. So your primary care physician, if they're referring you to a specialist, they'll also be submitting a referral for you. If you have a standing relationship with a specialist now, before your next appointment, you're going to want to contact your primary care physician and have them submit a referral for you. They can do it for a set amount of visits. They can do it for a set amount of time. They could set it for the year. But that referral is going to be required this year. Whereas PPO plans, that's still not a requirement in 2026. Not sure what will happen going into 2027, but for now, those are the two big differentiators between PPO and HMO. So in and out of network benefits and the referral requirement on the HMO plan. Just so you know, if you do have appointments coming up with a specialist, you'll likely be getting phone calls from your specialist. And the reason I say that is my dad's on an HMO plan and he's got some specialist visits coming up. And I've been getting calls all over the place from BJC saying, hey, I don't know if you knew this, but your dad requires a referral now to see the specialist. And I said, you know what? I do know that. And I actually happen to work in Medicare for UnitedHealthcare. So I'm very familiar with the process. However, there is a grace period. So I know there was a lot of people concerned that, I have appointments in January, and what if I'm not able to get my referral in time? There is a little bit of a grace period before any claims will be denied for the lack of a referral. That date is April the 30th. Again, best practice is to reach out to your primary care doctor now and say, hey, I have I have an appointment coming up with Dr. Smith, my cardiologist. They're telling me I need a referral. Can you please get that submitted for me? And then you're good to go. But a claim, if you have services and no referral is on file, that won't impact your claims or your pocketbook until after April the 30th. So May 1st. So there's a little bit of a grace period there. So nothing to, worry about.
Okay, so I just had a hip replacement. So if I go back to the surgeon for that, I need another referral for that, right?
You're going to need a referral. So
Okay.
there is a difference between a referral and an authorization. Referrals can't be denied. Authorizations can. So you needed an authorization to have the surgery. You didn't need a referral for that. So just to go back and follow up with your specialist, you will need a referral, but not an authorization. So that won't be denied. It just has to be on file that you're seeing a specialist.
Oh, okay.
And again, that goes back to what Diane said, is being the quarterback. And the reason that we put those requirements back in place was, providers were giving that feedback that, they want to be in charge of your healthcare. They want to know what's going on. And we can't just have members going to see whatever specialist they want and getting different medicines. And in a lot of cases, primary care doctors didn't know that was going on. And so they want to be able to keep track of, what medications you're on, what doctors you're seeing, so that they can, again, be the quarterback, know your medical history, and make sure they're getting you down the right path.
Yeah, that's good. Okay.
Like my doctor said to me last year when I was doing my thyroidectomy, and right before I had to get everything passed through the primary, my doctor, and he looked at me and he said, Diane, you've gone rogue. You've gone to other doctors that I don't know who they are, and you've decided to talk to them, to have conversations that I don't know the conversations that you had. So you need to start spilling the tea. Tell me what's going on. I was like, oh, okay. I said, now I understand. You need to be able to do your job. I did it wrong for you. I apologize. I said, you're supposed to be my quarterback. He said, you bet I am. He said, I'm the best quarterback there is.
Okay.
That's exactly right. So now getting into your plan, Phyllis. So you're on the ST4 HMO plan. That's our Medicare Extras plan. So of course, things are going to be different. Your copays are going to be different than they were last year. And if you can see here, it's this very first column. Can you see it?
No.
This very first column here. Is it too small for you on the screen?
Yeah, and I don't see you either,
Yeah, I'm not on camera. I didn't fix my hair today, and my makeup hadn't come in yet from Amazon. So
okay. All right. Now I see that chart, but it's so small.
Good. So I'll just go over the numbers here briefly for you. And, we could also share some files if you wanted an email or something like that. We could also send this to you. But your maximum out of pocket on the ST4 plan is $3,900. So the most you would ever spend if you were in the hospital or you had knee replacement or whatever the case might be, the most you would ever spend in 2026 would be $3,900. Okay. Again, this includes our provider network, national network. This plan comes with up to $155 in healthy rewards. So if you go to your member portal, and I know we're going to talk about that a little bit later, but if you go to your member portal, it'll tell you the ways that you can earn up those $155. Okay. For PCP copays, it's still a $0 copay. When you go see your PCP, you will not pay a copay. But when you go see a specialist, you'll be paying $50. At any specialist you see, it's $50. And again, the referrals are going to be required. Your inpatient hospital copay are $395 for days 1 through 7. So if you're in the hospital and you're there for over a week, you'll be paying $395 a day. But then after that, anything after that, it's no copay after that for an unlimited number of days. Okay. Outpatient services are covered at $395 copay, the same. No copays for colonoscopies. But for an ambulatory surgical center, it's a $295 copay. Any service done outpatient or ambulatory surgery, that's what it's going to be, $295 and $395 copay. Ambulance has a $290 copay. Your emergency room copay is $150. There's a $65 copay for urgent care. And again, for ER, don't look for an in-network ER. Go to the closest one, okay? You're not bound to the network requirement for emergency services, okay? Diagnostic and radiology services, it's a $200 copay, but it's $0 for mammograms. Lab services, again, those are $0. There's no copay. And then for your drugs, for tiers 1 and 2 drugs, there is no copay for those drugs. For tiers 3 through 5, there is a $520 deductible. And then retail, there's copays of $0 for tier 1, $5 for tier 2, and then at tier 3, 4, and 5, it starts a coinsurance. So after you pay your deductible for a tier 3 drug, you'll be responsible for 18%. UnitedHealthcare pays the remainder of that, up to $2,100. So the most you would ever spend on drugs in 2026 is $2,100, and that includes your $520 deductible if you have any tier 3, 4, or 5 drugs. So I'll stop and slow down there because I've just thrown a bunch of numbers at you to see if you have any questions or if any of that doesn't make any sense.
So before you answer, Phyllis, I did bring in the ST4 enrollment guide that we had at the beginning of this year, and there is a benefits highlight page on both of these 2 pages. And Courtney Hudson, my marketing assistant, she just took a picture of these 2 pages and she just texted it to you.
Hey, did I get a copy of that? I didn't get a copy of that.
Yeah, I just texted it to you. And then
okay.
you also received, everyone receives every year in September to October, everyone receives an ANOC, which is the annual notice of change. So definitely look for that next year if you didn't see it this year. But if you'd like me to send you the whole book that has the schedule of benefits in here, as well as the benefit highlights, I can mail it to you in snail mail.
Would you please?
Like
Would you please?
Of
Yes.
course, of course. And
Thank
put it
you.
in the chat, Sandy, and also Donna, put it in the chat if you want me to send you something too. And then for everybody who's going to watch this later, text me at 314-302-5743 and say, Diane, send me the enrollment guide for my plan, and then put your name of your plan or a copy of your card, and I will send it to y'all. Okay, now, Alex, you asked a wonderful question to Phyllis. What were your other questions, Phyllis? Okay, now what are your other questions?
Okay. I keep getting all of these advertisements to go to these meetings so you can join that a thing where it pays your if you have to be air flighted to a hospital or something somewhere, it pays all of that.
Yes.
Is that covered under our plan, or do I need to pay that too, you know?
So Alex, talk to me about ambulance, for ground ambulance and air ambulance. How is Phyllis covered in her ST4 plan?
The $290 copay for ground or air ambulance. That's it. $290 copay.
Okay, so
if you don't want to pay that, then the air evac that they're typically trying to sell you in the state of Missouri runs about $100, and it's an ancillary plan, which means it's an additional plan to your Medicare plan. And then they start to cover the air vac completely. Otherwise, with UnitedHealthcare, anywhere you are, ground ambulance or air ambulance, it is $290. And that goes with your medical maximum.
So I don't need to buy that ancillary plan from them then, you know, so.
If you don't mind spending $290, no, you do not.
Okay. I mean, that's reasonable, but you know, they're telling people, because I went to one last year, but you know, and I think I talked to you about it then, but they're telling people, you know, it's going to cost us $75,000 or something if we have to.
That's if you do not have insurance. And they're exactly right, because if you don't have insurance, It is very, very expensive for an air ambulance.
Yeah, okay, so I don't have to worry about that. All right, thank you.
Yeah, you go to a foreign country, you better call me first. That's a whole different conversation. All right, Alex, keep going.
All right. So the extras plan, this ST4 plan, really focuses on anything in addition to your typical Medicare covered benefits, right? So that includes ancillary benefits like dental. This particular plan has $4,000 towards covered services. So there's a $0 copay for preventative services, and then we'll cover any comprehensive services like, root canals, crowns, that type of service for 50% coinsurance. So you pay half, UnitedHealthcare pays half, up to $4,000. Okay.
Okay,
There's vision coverage. There's $0 copay for a routine eye exam and standard lenses, and it covers up to $300 every 2 years for eyewear. So up to $300. That's pretty good eye coverage. $300 it's pretty good.
yeah,
And then there's hearing aids. We used to have hearing aids that started as low as $99, but we got rid of that particular price point, mainly because the feedback that we got is that those $99 devices weren't very good, and there was low utilization in that particular category anyway. But this year you have options from starting at $199 up to $1,249 copay per device. And 2 devices every year through UnitedHealthcare are covered through UnitedHealthcare Hearing. So in the book that Diane is going to send you, if you go to the portal, before you get any kind of hearing aid services, whether you go to a provider to do that, or if you're doing it at Costco, wherever you're going, you're going to want to call UnitedHealthcare Hearing to get the authorization for that so that you can get the highest benefit available for your particular services. So make sure that before you purchase any kind of hearing device that you talk to UnitedHealthcare Hearing so that you can utilize that benefit properly.
okay,
Your plan also covers free gym membership with our premium and our core networks. So, that includes, your local gym, there's YMCAs, but it also covers some of those high priced gyms like Lifetime Fitness. That's the one that we hear a lot about. Can I access Lifetime Fitness? So yeah, so you have coverage to our premium and our core network when it comes to fitness. And then OTC for this particular plan, so that's over the counter, you get a $90 quarterly OTC credit in my UHCs. So that's a use it or lose it though. So you have $90 every quarter to use to buy things like vitamins or cough syrups, or there's a long list of things that you can buy. Again, you can see this information if you go to the My UHC portal and go to your OTC tab. You can also go to Walgreens. Walgreens usually has their items labeled as OTC eligible, and anything that you see with that OTC eligible, you can use your $90 quarterly credit to purchase.
okay,
If you're using the app as well, if you're in the store and you're wondering, hey, I wonder if this is covered by OTC, you can use the scanner on myuhc.com on your app, and it'll tell you whether it's covered or not. There is not a printed catalog for this, and it's a question that we get at the beginning of the year. Every year, when am I going to get my printed OTC catalog? We do not have one. They stopped doing it last year, and it doesn't look like they're going to be picking it up for this year. And one of the main reasons for that is just I think in 2024, which was the last year that they printed that OTC catalog, the prices changed so much. So what you were paying for something in January wasn't the same that you were paying for it in June. And then it wasn't the same that you were paying for it in September. And it just became too confusing. And not to mention that, the Green Initiative and wanting to go paperless, they're not going to be printing that OTC catalog anytime soon. So you're going to need to go online to check and see what's available. And all the information is listed there online on what you can use your OTC for.
okay,
There's other benefits also like post-discharge meals. So there's 28 meals over 14 days are covered, unlimited times per year. So that's if you're inpatient in the hospital and you come home and you need some help with some meals being covered. That is covered again, 28 meals over a 14-day period, unlimited times per year. Okay.
okay.
Did you have any other questions about that plan?
Well, I didn't have that meals coverage before, did I, on the PPO?
I'm not sure if you did or not. Let me look.
If I did, I didn't know it.
Yeah, you probably didn't know it. Yeah, it looks like it's covered currently, so I would assume that it was covered last year as well. Yeah, both of the PPO plans that we have in this market have the post-discharge meals.
So
Oh, okay.
that's a really good point, Phyllis, that Courtney Hudson, say hi. Say hi. Say hi. So Courtney came on to the team on October 1st. Can you believe she joined us the first
Uh,
day that we could talk about all the plans this year for open enrollment? She's still here. I can't
oh
believe
my goodness.
it. Anyway, she just graduated with her degree in social work. And so I met her through Voice, that's the ombudsman program for eastern side of Missouri, that gives the voice to those that do not have any family members that can advocate for them in facilities, and over 500 facilities as nursing homes on this side of Missouri. And so that's how Courtney and I met. Anyway, one of the things that she's doing, one of the initiatives, is to let the social workers know how these plans work. And I think you just brought up a really good point, Alex, and also Phyllis, that Courtney needs to let the social workers know and be aware of those 14 meals, because the health system here, all of them, which we have 5 of them, some say we even have 6, but we really have 5 systems. All of them have social workers, and they're all looking at making sure everyone is healthy enough when they go home that they're not going to boomerang back to the hospital. So we're going to promote that. We got to put that on our board of something that we need to let all the social workers know in the St. Louis area that's available, to make sure that the hospital hopefully will not receive them back in. Because when you go back to the hospital for the same reason, guess what? They don't get paid again. So they're going to love having this information. So Alex, thank you so much for covering that in depth. I appreciate it. And Phyllis, thank you for asking, did I have that last year? Because it just lets me know we need to promote it more. So thank you, Alex.
You're very
Yeah, 'cause
welcome.
they don't know, because I asked, when I came home from the
Yeah.
rehab place and everything, if I could get Meals on Wheels or anything like that, for a little while.
Oh my goodness, because even through Aging Ahead, which is part of the Missouri, it used to be the Missouri Assistance Aging uh, Answers. And now it's now called Aging Ahead. At sometimes during the year, you can get meals through them as well, and they can also set up Meals for Wheels. So again, I think that's a really good opportunity for us to share with the social workers.
Yeah, and honestly, I don't know if it's that they don't know or they don't have time to know. They take on a really, really heavy caseload. Social
is
workers do
heavy.
at the hospitals. They don't have time to be as effective as, somebody that's not in that big of an industry kind of as a social worker.
Mhm.
So I think it's a great idea that they need to
Thinking
know
we could
this.
probably put a card, and then on the back of the card, it could say UnitedHealthcare and then the 14 meals
Yeah.
and this and and that. And so if they can come in with any of the plans, they'll know exactly what they
Yeah.
have.
Anything we
So,
can help them to
yeah,
know
to
helps them.
quickly.
Yeah.
So yeah, thank you, you guys. Okay, wow, we just had a good brainstorm here. Thank you. Go on, Alex.
All right. So that was all on the ST4 plan. So that was the HMO extras plan. Sandra, you wanted to know about the PPO plan, the ST2 plan. That's the one that doesn't have the monthly premium. Again, in the interest of time, is there something specifically you wanted to know about the plan? Did you want me to run it down the same way I did for Phyllis on that particular plan? What exactly would you like to know about that plan?
I think you could just run it the way you just did it real
Do
quick.
the same?
General
Okay.
overview. That would be wonderful. Yeah, that'd be
All right.
great.
So the UHC ST2 PPO plan, what's different from this plan, the plan that I just covered, is that this plan does have in and out of network benefits. But as you see, that changes the way some of this stuff works. The maximum out of pocket on this particular plan is $6,700. That's kind of the price you pay for going out of network. Also, on top of that, there are some freedoms and liberties with going with a PPO plan, the ability to go out of the network. However, going out of the network is going to cost you a little extra money. Those doctors don't have contracted rates, and they are able to bill you the difference from their contracted rate and what UnitedHealthcare pays. So it's kind of risk and reward and all over the place, but at least you do have coverage. You will have some coverage. But for this plan, $6,700 would be the most or the maximum out of pocket you would pay total. This plan also qualifies for up to $155 in healthy rewards. There is still no copay when you see a PCP, but the specialist copay is $60. This plan, though, does not require referrals. Inpatient hospital copay is $550. Ambulatory surgical center and outpatient hospital copays are $450 and $550, respectively. There's a $200 copay for ground and air ambulance on this particular plan. $130 copay for emergency room, $50 copay for urgent care, $200 copay for diagnostic radiology. Again, there's $0 for mammograms, and there's a $5 copay for x-rays. Lab services are covered 100%, no copay. And then for prescription drugs, again, for tiers 1 and 2, there is no deductible. The deductible starts at tiers 3 through 5, and that's a $600 deductible. And then for tier 1, there's no copay for tier 1 drugs. There's an $8 copay for tier 2 drugs. And then for tiers 3 through 5, you're paying a coinsurance of 16%, 41%, and 26%, respectively. And insulin is capped at $35. Now, the $35 was for the other plan as well. So if you're on insulin, $35 is the most you would pay for insulin. Again, $2,100 is the max out of pocket for prescription drugs. So again, you will not pay more than $2,100, and that includes the $600 deductible that you'll pay. For this particular plan on ancillary benefits, it has preventative dental services only. So there's no copay when you go get preventative dental services. But if you need anything like a crown, root canals, any kind of comprehensive services with this PPO plan, there is no coverage for that. This plan only covers preventative. However, you do have the option of purchasing a platinum dental rider, but you have 90 days to get that done. So from your effective date, you get 3 months to purchase that platinum dental rider. That gives you $1,500 in coverage for comprehensive services, and it's $55 a month. With the caveat of, once you use those benefits, if you want to cancel, you can cancel anytime and not pay that monthly rate anymore. I don't think a lot of people know that. Yeah, preventative dental services only for this particular plan. However, you do have the option for that dental rider. And then the dental rider works the same as if you had the dental coverage. It covers $1,500 max and 50% coverage on those comprehensive services. Routine eye exam works the same, $0 for routine services, $300 for eyewear every 2 years. The hearing benefit works the same, $199 to $1,249 copay per device, 2 devices every year. And again, you have to go through UnitedHealthcare Hearing to take advantage of those benefits. The free membership with premium and core network on the fitness benefit is the same. This plan does not have any OTC coverage, so there is no over-the-counter coverage on the ST2 PPO plan. And the post-discharge meals are also covered the same, 28 meals over 14 days, unlimited times per year.
So Renew Active being the fitness program, it's important in the St. Louis area that we know that the J is part of that program, because lots of people in our area ask me if the J and both locations are part of it. And then there's many more that are located on the Renew Active. And I will point out that it does make sense to go into Renew Active and look at it and see what type of programs are available at home. And they have home supports. They also have meals that you can, healthy meals and healthy meal plans that are available. And it's just awesome, all the things that are on there. I will also mention too that with
What is that? What is that on? Where do I see that?
when you go onto the Renew Active site, so renewactive.com, you can see that. The other thing that I want to mention too is if you need more vision in the middle of the year, if you need more dental in the middle of the year, you can always call me and we can always look at the ancillary plans that are available. Ancillary means additional to Medicare. And so there are plans that you can add in the middle of the year, and you don't have to keep those plans. It's just a matter of mitigating the cost for hearing and dental and vision and adding to the benefits that you already have for Medicare. Same thing goes with hospitalization or going to the rehab center or having an outpatient surgery, or if you need to have physical therapy or speech therapy or occupational therapy or chiropractic. Those are plans that we can put together ahead of time that are in addition to what you have right now in your benefits. And it's to help you cover the copays so you're paying a lower amount out of pocket instead of receiving the full bill to you at a later time. So those are just strategies that we can always look at throughout the year. And I'm so happy that UnitedHealthcare supports all of the different programs with the hospital indemnities. They support the programs with the dental and the vision and adding those things to the plan that you already have with Medicare. And I'll also point out too that some people will say, Diane, is there a plan that I can travel with? And that PPO, you can still travel with it. All of the plans you can travel with because you have access to urgent care as well as the ER in your network. In the PPO, though, if you were going to go to Florida and you were going to be there for 6 months, you could set up an appointment with a physician in Florida, and you could set up an appointment with a specialist in Florida. And if they were in the UnitedHealthcare, if they were in network, you would get the UnitedHealthcare network rates. If they were out of network, you would pay the out of network rates. So it does give you some more flexibility and a much more robust choice for your health care. So if you find out that there's a surgeon here in St. Louis, for example, and that you ask that surgeon, where'd you learn how to do this? And they said, I learned how to do it in Atlanta. You could probably go see that person in Atlanta on that PPO. So I just want to let you guys know there's some perks both ways. So Alex, what were you going to show us next? The formulary?
I saw in the chat that Sandra asked what tier Eliquis was on, and Eliquis is on. It's a tier 3 drug per the 2026 formulary.
And what's the cost? Is it $47?
40. Let's see. For the what plan was she on? Sandra was on the PPO plan.
PPO,
Tier
0.
So the tier 3 would have a $600 deductible first, and then the coverage would be 16% after that.
Okay.
Yep.
So which seems to be about $47. It used to be a little bit more than that
Yep.
prior to it. So there's an international rate right now with Eliquis that's not through UnitedHealthcare. It's the international equivalent through the Canadian pharmacy, Canadian med store. That one runs at $159 for 3 months. And then it's $241 for the actual Eliquis, the name brand that we have in the United States. That's one of the lowest rates that I've found. But again, y'all, if you run into a particular drug and you think, gosh, what is the cost of this outside of Medicare? Just send the name of the drug to me, text it to to me at the 314-302-5743 or text it to Edith Voiles, my operations assistant, at 314-920-3990, and just say, hey, this is the drug we're looking at. This is how we want to fill it. This is the pharmacy that we prefer. And then we'll look and see if there's anything that we can find that would be a lower rate than what is offered through Medicare. So we're happy to do that for you. We do that for, oh my gosh, so many people. It's intense.
There are so many options. There are so many options with drugs, because there's a lot of good drugs out there that are very, very high priced. But there's a lot of options. A lot of times the manufacturer offers a coupon that works in conjunction with your insurance coverage, and it brings the price way down. I'm a recipient of one of those drugs and one of those discount coupons. And there's websites like GoodRx, and there's just so many different options. You're never just stuck paying that $1,000 bill. When you have coverage, there's a lot of different options. Always ask the question, always do your research before feeling like you have to spend an exorbitant amount of money or that you have to go without. So please ask questions.
Quick question.
Sure.
Is the eye drop MIBO on the schedule?
Actually, I just closed. Let me see if I still have it up.
MIEBO is the way you spell it. It's an eye drop.
Say that again.
MIEBO. MIBO.
MIBO. Yeah. I see the commercial all the time.
Yeah.
That's like the one that I think that they should hire me to do the commercial is the omeprazole. I say it's omeprazole, like don't eat the ravioli, take omeprazole.
I'll vote for that, Diane.
Commercial. It'd be a great commercial. It would be great.
I don't see it on the formulary. Let me look to see if the generic version of it or if it has a generic version.
So while Alex is looking that up, I will let y'all know that there's also an appeal process too. So if there's not a particular drug that's on the formulary, you can appeal it and you can call the 800 number on the back of your card and say, hey, I need to appeal this, or walk me through the appeals process. And typically what they're wanting to see is a letter from your doctor saying that there's no substitutes for that particular drug. You've tried all the other substitutes, and this is medically necessary. It is not elective, and it's not cosmetic. And so once they see that, then they know, oh, this is mandatory for you to have to live. And then they'll run it through their system of appeals and try and assign a tier level to it. Did I explain that right, Alex? I think I did.
Sure. You sure did.
Okay.
Sure did. I am not seeing that MIBO or its generic equivalent is listed in our formulary.
Somebody somebody just posted they also use that eye drop. Who did that? It popped up and then it's gone.
Oh, it might have been Donna or Sandy. So I'll find out from them if they've found it any cheaper anywhere else. So
yeah, because my eye doctor prescribed that for me, and it was going to be like $497 for a little bottle of it.
Well, text it to me, and then I'll look it up too on my end and see what I can do for you too. Otherwise, we could send it through the appeal on there with UnitedHealthcare. So while I've got Alex on the call with us, I need to tell y'all and make sure that everybody who sees this in the future, that they understand that every broker leader here in St. Louis is outstanding. They have to be. And I will tell you why. We are the third area in America to release plans. Why are we so popular with plan releases? It's because we have 5 hospital systems. There's Mercy, there's St. Louis University, there is BJC, there's WashU, which is part of BJC, there's SSM, and there's also St. Luke's that's also in conjunction with Cleveland Clinic. So we have wonderful places that we can all go receive healthcare, but all of those healthcare systems are different. So all of these plans have to work in all these different healthcare systems. Everywhere else in America, they might have 2 hospitals, really. And so they don't have this robust amount of options that we have in St. Louis. So as a broker leader, it's Alex's job to make sure that I know what I'm doing.
Okay.
It's a big job, isn't it, Alex?
It is keeping all you guys in line.
Me and hundreds of other brokers in the area. So what happens is Alex has to be top of his game and he has to be the best. And I will tell you, I witnessed it. I was at the Heart Association, and UnitedHealthcare was the only booth that was there for the Medicare Advantage plans, and I was able to represent the brokers for that particular booth. And Alex and I got to talking, and I got to meet the chief of this, the chief of that, and his whole team that supports him. And I'll tell you what, he's got a long line of people that want his job. So he has to be the very best, and he is. So we're so lucky to have you, Alex. Thank you so much.
I
Yes.
appreciate it.
Yeah, absolutely. Oh my goodness. Everybody here in St. Louis is so well respected. Anytime I go anywhere in the United States for conferences, they're like, "You're from St. Louis? Do you know how lucky you are?" It's amazing.
It's very true. There's some big cities that don't have as many hospital systems as we have here. So we're pretty fortunate, especially being such a small market. We're very well represented here. But again, it goes to talk about our pretty vast national network, because we will have that same coverage in all the major cities as well, with the exceptions of a few here or there. But at the end of the day, we have a lot of options for our folks.
Yes, and it's amazing because the national plans, like what we're looking at, that PPO plan, that model of plan, the name might change, because a lot of you know that I'm in 29 different states. I'm based in St. Louis, but then y'all call me and say, "Can you help my brother or my sister or my aunt or my uncle?" And I help them. So I add these states. So when I look at the plans across the country, that one, it sticks out. That ST2 is one that they have really flushed it out across America. So it's fantastic. And they all share information, and I'm sure it makes it easier to gain what is popular for everyone in America. So with that in mind, Alex, what do you think is going to be popular for everyone in 2027? What's the feedback so far? What is everyone saying? That they want the over the counter back, or they want more options for, eyewear, or what's the buzz? Because I know you have to kind of come up with the plans as of April is the first draft. So
Now we start working on this stuff pretty early, and there really is no rest. I know agents, after AEP is done, they say, "Oh, I'm going on vacation. I'm not answering the phone until January, blah, blah, blah." But there really is a lot of work going on behind the scenes already. We started to debrief already on the feedback that we got. We're going to be pulling our agents in here soon to go over some feedback that they're hearing, what they're seeing, what would make us more competitive, what would make their lives a little bit easier. And one of the big things that we hear every year is dental. We need to focus more on dental. A lot of people choose their plans based on the coverage for dental. The OTC carries a lot of weight. It's very interesting because people want the OTC coverage. They want the money to be there. They want it to be available. But then on the utilization side, it doesn't show that they use it. So it's kind of a hard thing. You can offer somebody $100 a quarter. You can offer it for it to carry over. And then when you look at utilization reports, people forget that it's there. I know my dad forgets that it's there. I know sometimes we forget to use it for my dad. And then some people say, "Man, $50 a month, I don't know what to do with it. I can only buy so much NyQuil. I can only buy so much Band-Aids." So some people, use it for your kids, use it for your grandkids, help them buy diapers or something like that. So we get a lot of that. So dental and OTC has a lot to do with it. What we saw last year was we saw a migration of folks go from the ST3 plan to the ST4 plan. This year, we saw an even bigger migration to the ST4 plan because ST3 no longer offered dental and it wasn't offering OTC benefits anymore. So we saw more people migrating to the ST4. The PPO business is kind of in a state of flux. What are we doing with PPOs? PPOs, to be perfectly fair, this year it was a business that we were not trying to grow. We didn't want to lose any of our customers, but we didn't want any new customers on the PPO plans because the PPO plans are expensive. They're expensive to run. They're more expensive for our members as well. So sometimes we kind of scratch our heads and say, why are people paying money for that? Why are people spending the extra money? And again, it's for that security because it was the old way of doing business. People swore by PPOs, but most people can't tell you the difference. So what happens to PPO going forward? We don't know. Are they going to be there in 2027? We don't know yet. We're providing that feedback. Clearly, even especially here in Missouri, we have some areas where there's a lot of rural counties that don't have the 5 hospital systems that we have here in St. Louis, and they need out-of-network protection. So they want more robust PPO availability, and right now they don't have that. So my guess is that there's going to be bigger investment into ST4. There's going to be, dental is going to continue to be looked at as, what's important. Dual plans is a whole nother name of the game. And, we don't have anybody on here on a dual plan. I know somebody who's on a chronic plan. The chronic plans are good plans. If you are diabetic, if you have a cardiovascular disease or chronic heart failure or anything like that, there's the copays are a little bit less. Insulin is a little bit cheaper, even though it's capped at $35 on the other plans. For chronic plans, it's capped at $25. So there's some perks to that, but there's going to be some major changes, I think, to the dual benefits and how it pays for, and this year it already happened, how it pays for OTC and how it pays for healthy foods. So I think that's where we're heading towards in 2027 is making our plans stronger. Again, focusing on, because members and agents are looking at our ancillary benefits, and I think that's what's selling our plans right now.
Absolutely. I think that the mentioning of the plan for chronic is really important. So as you see those 3 plans, you're looking at the plan all the way to the right, and that would be the UHC Complete Care MO-1 PPO C-SNP. And the C in that C-SNP means Chronic Special Needs Plan. So anyone throughout the year that would get or already has diabetes or a heart condition or COPD or stroke, then they are a candidate for a chronic plan. And they can get into that chronic plan anytime during the year. It is an open enrollment throughout the whole year. It's a one-time switch in, and then you can't switch out of it. Unless, of course, your health changes, but usually, once you become chronic, you're chronic. So that would be very, very few. So typically you switch in one time, and it's going to start the first of the next month when you switch into it. So that's interesting to look at for people, because things might be fine in the middle of the open enrollment, the annual open enrollment, which is October 15th through December 7th for a January 1st start date. But then health can change during the year. And so I think that that's really important, that everyone knows that chronic plan, you can get into it anytime during the year. So keep that in mind for yourself if things change, and keep that in mind for your friends if it changes for them, because the government is really paying attention to those chronic plans and is giving extra money to those chronic plans. And in those chronic plan formularies, it's a much more robust formulary. Typically, it says that you only have to have 2 of a certain type of medication for a certain type of illness offered on the formulary. And in those chronic plans, you might see 3 or 4 already included on the formulary. And so you wouldn't have to do an appeals process to get a particular drug, because it has a much more robust formulary. And that's something that can really help people access the medicine that they need for their chronic. And they also get extra resources for their chronic disease and follow-up. So especially the diabetes education that goes with it, as well as there's even some podiatry that's extra that goes with that too, that I know has really helped some clients. So anyway, keep that in mind for yourself or friends that you hear might have a chronic need. I just had to plug that because I've just seen the benefits of it, especially with UnitedHealthcare. And I thank you so much, Alex. You got to tell those people, thank you, thank you. They have made a huge difference in a lot of lives.
There are some perks to that plan, and I get a lot of agents who say when you look at the benefits don't stack up to some of the other benefits. Why would somebody move to the to the CSNP plan? Well, those are the reasons, because the formulary might be more robust, because insulin is a little bit cheaper, because there's OTC benefits involved, because those OTC benefits on this particular plan, you could actually use those to pay for healthy food, where you can't do the healthy food with the other plans on the OTC. So there are some perks, but the main perk is that, again, you might have a new diagnosis, in June or July, and now you can switch into this plan, which otherwise, outside of another special election, you can't drop the MAPD plan that you're currently on. So that's what's important. I know, Donna, you mentioned that on this particular plan, the out-of-pocket is way too high. I don't disagree with you. I think even for our lowest out-of-pocket plans, so like even our ST4 plan, which on this screen shows $3,900, I think that's too high. But, throwing facts and throwing data at it, do you realize what it takes to get to $4,900 and what you have to do to get to $4,900? Because when you look at being inpatient hospital and only paying copays for the first 7 days, that's not going to get you to $5,000. You really have to have a really, really bad year for you to get to a $5,000 out of pocket. Well, in this case, it's $4,900. And to be perfectly honest, the number of people that get to their out of pocket every year is less than 90%. Only 10% or less people meet that out of pocket. Last year in 2025 or 2024, I believe, 50% of our members didn't even spend $300 out of pocket. So when you take that into consideration,
they're the ones at the gym.
Yeah. $4,900 is scary. It sounds scary, but a lot of things have to go really bad for you. And not that they can't, because it can. And that's one of the reasons to be insured and to have the coverage. But if all the things that it would take for you to get to a $4,900 out of pocket happen, that's still the most you would ever spend. Where I'm talking about bad car accidents and broken bones and surgeries and all that stuff, for you to only have to pay $4,900, as scary as that number sounds, your hospital bill is going to be in the millions of dollars. So can you go without it? No, you can't. So, I mean, when you really look at the data and look at how many people actually ever get to that number anyway, it is very minimal. And hopefully you never get there, and hopefully nobody ever gets there. And that's what we see. 90% of the people do not get to that number. So hopefully that puts your mind at ease a little bit. But I know it sounds scary to get to that number, but it's more likely than not that you'll never get there.
So let's concentrate on those that are healthy, right now, instead of those that are become, very sick and unhealthy and meet that maximum out of pocket. You can see the AARP on each one of these plans, except for the chronic plan, because it's funded differently. But AARP has a partnership with UnitedHealthcare. They're just in partnership with each other. But I do want to let you know, you don't have to be a member of AARP when you have a Medicare Advantage plan. But I do want to let you know that AARP, the vice president came to me and he said, "Hey, Diane, do you know about all these benefits of AARP?" I said, "No, I'm going to be 55." And I am 55. He said, "You're old enough." I'm like, "Oh, good Lord." So what happened was he said, "You need to get a card, and you and Eddie need to get a card. My husband, you need to get a card." So we did. Oh my goodness, this last year with our AARP card that we spent $15 on, this is all we spent. We saved $241 Now, what did we save it on? We got into two, we didn't even count this, but we got into two of the national parks for free, because you get into national parks with the AARP card for free. And then we also stayed at the Hilton, the Drury, and the Hampton, and they're all part of AARP. And then what's the other one? Texas Roadhouse is part of AARP, Kohl's is part of AARP, and then AMC Theaters is part of AARP, and part of the Asheville area when we went there for the reverberation and the celebration of Asheville downtown opening up this year. Oh my goodness. So we went crazy with the AARP. We just said, we're old. To give us a discount. And so anyway, it all totaled up to be like $241. So if you don't have an AARP card, go get one. It can only help you. And everywhere you go, tell them, hey, I'm a senior. Can you give me a discount? Because that's what I told Bob Evans the other day. And they said, you're a senior? I said, I am. I can show you my proud card that proves it. And they said, well, you get 10% off. So I got free biscuits. I was so excited. So. So that's my spiel on AARP. I don't know what else you want to let them know about, Alex. So hopefully
I'm not fully versed. I'm not fully versed on AARP since I'm still in my 20s. But no, I'm just kidding. I wish.
We're gonna get you your card, carrying membership.
I'll be there soon.
Oh my goodness. So Alex, tell us one thing. This is the thing that we'll end on. Your tell all be all story about UnitedHealthcare, why you are so proud to be part of the management team and the broker leader here in St. Louis. What your story is when someone says, tell me about UnitedHealthcare, what I can expect from them. What is your go-to story that just kind of sums it all up? What makes you proud about being a part of UnitedHealthcare?
I will tell you that I've been at UnitedHealthcare for 20 years. March will be 21 years that I've been at UnitedHealthcare, and I didn't come in as a Medicare market manager. I came in as a customer service agent as a young guy in my 20s, just looking for the next job, right? And I've grown at UnitedHealthcare. The sky's the limit potential. You know, when you do your job, you know, it sounds very cliche. When you do what you're asked to do, and you stay curious and you want to grow and learn, UnitedHealthcare is a good place to do it at, and they've been very supportive of all. You know, I turned a job into a career, and I love it. And the reason I love it is because UnitedHealthcare, despite all the negative press and despite all the negative stuff that you see about us, I know that it's a group and it's a company dedicated at doing good in the community, and we truly are trying to make people live healthier lives. You know, and I'm so proud of that. When we're asked, am I proud to work for this company? I've seen the good work that we do in the community. I've seen the money that gets donated. I participate in the money that gets donated and the volunteer stuff that gets donated. And UnitedHealthcare is a place to do that. That's my go-to story. Is that I'm proud to say that I wear my stuff in public. I don't care when people, you know. Last year was a difficult year for us. A lot of people saw, oh, you work for UnitedHealthcare. Ooh, I bet that sucks. No, it doesn't. I love working there. I love working there. I have a roof over my head. They do good. They do good by us. And they do good stuff in the community. And I've been part of, you know, like I said, I started as a customer service agent. I got all the nasty calls when we messed up claims, and I know that we're dealing with people's money and we're dealing with people's health. So I got all the nasty calls. There isn't anything that I haven't been called or heard when I was on the phones. I did it as a supervisor. I did it as a business manager. I ran the call center for the longest time. And trust me, I've listened to every recording and seen every screenshot of everything. And we do right. We do right by people. We do make things right. We make mistakes like anybody. We make mistakes, but we do make it right. That's why I'm proud to work for this company, because I know we're going to do it right by folks. We're never going to rock the boat too much. We're going to stay conservative. We're going to stay the course. We're not going to do any shock and awe things. We're not going to just drop things and offer you shiny gold pennies and, you know, tell you the sky's the limit and then take it from you later. That's just not how we do business. We're going to stay conservative. We're going to be boring, but we're going to be boring next year, and we're going to be boring the year after that. But we're going to consistently pay your bills, and we're going to do right by you. So
Alex,
that's my go-to.
Thank you so much. It has been so wonderful to know that you've got my back, and I certainly have your back too. And it's been great that when clients have called me and I have said, wow, I haven't ever in 30 years of doing this, I haven't ever come across that. I've known that I can call you and you can say, Diane, this is how it's handled. and you
Yep.
tell me exactly what to say. And even if you're on vacation, you will return my phone calls. You are so wonderful. So I appreciate you so much. And I have absolutely loved and will continue to love working with United Healthcare as a broker. And I know my clients will continue to enjoy the benefits that they have worked so hard for to earn their Medicare and to earn their benefits. And I appreciate that you take the time to spend with me, take the time to pour into my clients, and take the time with everyone, not just me. You make everyone feel special. Thank you so much. I
You're
appreciate
very welcome. Diane, I appreciate you saying all that. And before I leave you, I will leave with one more thing. You guys have a great agent, but you also have a very busy agent. All our agents are extremely busy. Before you contact Diane with a crazy issue or an escalated issue or something that you think that Diane is going to get you out of, she will eventually. Don't forget that we do have a great customer service team. Despite all the negative stuff that you
Yes.
hear, please do not forget to use your tools. Diane can't escalate anything for you until you've contacted member services at least one time. Use our member services. Reach out to them for everything. They can help you with everything. They can help you find a doctor. They can help you find your prescriptions. They can help you tell you what your prescriptions cost, your dentist, your eyes, everything. Try our member services. But even more importantly, and if you're sitting here today and you haven't registered to our MyUHC portal or the app, you're doing yourself a disservice. Because everything that Diane can do for you when you call her, everything that member services
I
can
do
help
it
you
through
when you
that.
call them,
Mhm.
you can do it on the service. So we always talk to our agents when they ask us questions. I'm like, you could have just gone to your Jarvis and saw that answer. I don't say it like that. I try to be nice about it. But everything that you're going to ask Diane to do, she's going to go to the same tools that you have available to use for yourself. Don't forget that. Our agents, I have 615 agents under my hierarchy. They're all important to me. Some talk to me more often than not. And the ones that I don't hear from a lot is because they know how to use their tools and they're finding it. I know from certain folks, when they reach out to me, it's something that they've already tried to help themselves with. Do the same for your agent. Try to learn and verse yourself with this stuff. The book that she's going to send you guys, the explanations of benefits, all of that stuff that Diane promised she'd send you if you text her and give your address, it's all right there on your phone or on your computer, ready for you to see. And you don't have to make Diane spend how much are stamps now? $350 each? It's what it seems like
think
anyway.
so. They went up to $500.
They're $500 a stamp. So just kidding. So I wanted to plug that. I know I didn't get to show you guys a demo. I'm happy to do that another time, Diane, if you want to get some people together and we can do a demo and show
That
you guys
sounds
how the
good.
portal works. That's those are some very important tools for you guys to get yourselves very familiar with.
I
So,
think the answer is yes to that. So I will be I will definitely get back to you, Alex,
great.
about that. And as I think we all would love a demonstration about the portal and the app and just how to use that so that it can
Yep.
save them time. And I think everyone would love it. So
Yes.
the answer is yes. And I think, definitely like next week, let's try and get it done. So
Happy to do it. Just let me know.
I will let you know.
All
Absolutely.
right.
Any
You guys
last
all
minute
have a great afternoon.
questions? Any last
Thank you,
questions?
Alex.
Okay, we're good. All right. So Alex, thank you so much.
You're
Appreciate
very
you.
welcome. Have a good rest of your day, guys. Thank you.
All right. All right.
And
He's
thank
gonna sign off.
and thank you, Diane. I'm so happy that I met you and that
Oh,
I'm one of your clients now. You've helped me so much. I really appreciate it.
thank you. Thank you so much. Well, I absolutely love everybody, and you're one of those everybody's that I love. So, it's like helping my mom and my dad. I can remember my dad looking at me one time. He goes, "Can't you just figure this out? This is what you do."
Yeah, right.
And none of you have ever said that to me. Can you just figure this out? This is
Oh, me.
yes, I can. Just give me a second. I will figure it out. But thank you for your compliment. The compliment is that you're here spending time with me and you're valuing the fact that I value education and this is what it's all about. So
Yes, yes.
absolutely. All
And
right.
I think I'm going to be very happy with this HMO plan and everything too. So
Oh,
thank you for
good.
everything.
Oh, you're so welcome. You'll have to give me some feedback on it.
Don't forget
So,
to send me that information. Now, I didn't text you for it, but
no, I've
like,
got it. I've got it.
okay.
Courtney wrote me I've got a note from Courtney right here that says,
Okay.
send that to Phyllis. Don't forget.
Okay. Thank you so much. I appreciate it.
All right. Mwah. Right back.
Uh,
See ya. Bye. See you.
bye-bye.
All right. Bye-bye. I'm going to try and sign off. I don't know how. Hopefully
Yeah, I don't
Courtney
know
can
how
help me.
either.
I'm like, how do I do this? So Courtney had to leave early. So we'll see. We'll see if I get it. Oh my goodness. Okay, let's see here.
Bottom right.
Bottom right. Yeah, but but I was recording. So how do I go?
Yeah, just hit E.
Just hit end? Oh, we just hit end on the bottom right. Do you see it, Phyllis?
No.
It's on the bottom right of your screen, the very bottom right.
Once you exit, she should exit.
Okay, I'm gonna exit out. Okay, see you later, my friend.
Bye.
Okay, bye.